I'm Dr. Neil Martin. So let me just examine a couple things here, okay? I'm gonna ask you to touch my finger and then your nose like this. Okay, good. I want you to take your fingernail and tap it in the crease of your thumb, just like that, fast as you can. Okay, good. Hold your hands so they're completely parallel to the floor. Close your eyes. Okay, that's good.
We're ready to bring you in.
In order to investigate this thoroughly, I want to get an MRI scan, a high resolution, high field strength magnet MRI scan.
The first image will take us 5 seconds. Please remember to hold very still.
That'll give us a very clear picture of the brain structure. We're also going to do a functional MRI scan. So in the MRI scanner, you're going to be doing some activities that are going to cause different areas of the brain to become active and therefore visible on the MRI scan.
So you won't be speaking out loud, but you'll think of the names as you see the pictures, and when it tells you to rest on your screen, just clear your mind.
The other thing you're going to do is to have a throat swab just to check for strep.
Please take your time out.
Because if you have an ongoing strep infection, that can cause the body to react and affect your heart, your skin, your joints, and your brain. Our job here is to rule out some life-threatening problem that we can treat and cure and prevent a problem for you in the future. We don't want to leave any reasonable stone unturned in trying to find out what's at the cause of this.
16-year-old Alycia and her dad Randy are here with us now, along with Dr. Martin. So glad you could come.
Thank you. Good to see you. Thank you.
And so, Alycia, how long have you been dealing with these symptoms now?
I've been dealing with these symptoms since May.
And let's talk about this, Dr. Martin, because you did a lot of studies, and so often patients will say, okay, you did all these studies, what did it show? And sometimes the best thing is if it doesn't necessarily show anything.
Right.
So let's walk through some of what you've tested on Alycia.
The first thing I really wanted to do was get the brain MRI scan, because we wanted to be sure with the highest resolution scanning that we didn't see any small subtle abnormality in the brain or in the pituitary gland or in any of the structures related to the brain. So your brain looks completely normal. There's no trouble with the circulation to the brain. Your pituitary gland is healthy and normal as well. Now, the other thing I was concerned about was the possibility of an immune reaction from a strep infection, the same thing that can cause rheumatic fever or heart problems. The body reacts to the battle against strep bacteria, and then it can become overactive and attack normal tissues. That can happen in the brain and cause abnormal movements. It can cause tic-like symptoms. So, we did your throat culture yesterday, and I just got the report back today that it's negative. You don't have a strep infection now.
And we also have some images that we can show everyone, and this is from her studies, right?
Right.
Let's go over here really quickly, Dr. Martin, pull these up for everyone.
Well, Travis, the first thing we wanted to do was to look at the structure of the brain very carefully. And these are structural images from an MRI scanner, a 3 Tesla MRI scanner, high magnetic field strength. It allows us to look at the structures very, very carefully. You can see the cortex on the surface here, the white matter, the fluid cavities in the brain, and all of that, fortunately, looks entirely normal. And then this scan here shows activation while you were doing language-related tasks, listening, reading, thinking of words. Up in this area, the expressive language area, where you talk, where you write, everything looks normal. And farther back in this area, we see as well in the receptive language area, where you hear, listen, understand, and read, again, we see normal function in the brain.
So everything you're seeing here light up is lighting up appropriately
Exactly.
in Alicia's brain. Now, what do we have here?
This is a functional MRI scan and fiber tracking in the brain, just as we do in a tumor patient. And we can see, as we go back and forth, we can see fiber tracks running through the brain. We can see on this side the speech center, the comprehensive center, and in gold, the fiber connections between the two. I wanted to assess this as thoroughly as possible, because she has some tics that are verbal tics, where she grunts or makes a noise. She has some tics that are motor tics. The motor centers are visualized here, the interconnecting fiber pathways. We wanted to really define the entire wire diagram of Alicia's brain to see if we could pick up any abnormality. I'm happy to tell you it looks completely normal.